Welcome to the tutor briefing for the CT2 Simulation Day for the Northwest Deanery. Can I first of all thank you for your support. The training day will run from 8:30 to 4:30. There will be 32 CT2 trainees in groups of 8. There will be 4 stations of 90 minutes duration each. The stations break down into a high-fidelity simulation station looking at common medical emergencies, though the focus will be on management, teamwork, leadership and comm skills. The communication and history stations are akin to those trainees are exposed to during PACES exams, though the scenarios will be slightly at variance in some cases. Due to the comm skills and the history stations, there will be 1 trainer for 4 trainees, with simulated patients rotating through your group. In the virtual ward round, there will be 1 trainer for 2 trainees. 1 trainee will be playing a CT2 and the other an F1. There will be 1 simulated patient per scenario in the virtual ward round. This is the table for tutor allocation on the day. Please note that comm skills in the history station have been amalgamated, so can I please ask those individuals in these stations to familiarize themselves with both the comm skills and the history scenarios. The simulation cases have also been emailed to yourselves. Note that during the virtual ward round, X-rays, any other form of radiology, ECGs, prescription charts, path reports, etc. will be available to you for your scenario. And this is the breakdown of the day. As you can see, the groups of 8 trainees will rotate through each station and will have exposure to all the clinical scenarios. For smooth running of the day, can I please ask you to stick to time? In the comm skills and the history stations, we are asking that each scenario takes up about 20 minutes. Roughly 14 minutes where the trainee communicates with the simulated patient, and then about 6 minutes of interrogation and feedback. I would urge that feedback also comes from yourselves, peers, as well as the simulated patient. In the virtual ward round, there may be some variation in how long there is interaction between the trainee and the simulated patient, and how much time you give to communication between yourselves about the clinical case. I would still urge you during the virtual ward round to have time to provide feedback on what the student did well and what could have been done better. The virtual ward round will run as an OSCE, and we're going to have a timing scenario, so the trainee will have 2 minutes before they enter into the scenario to look at the brief of the clinical case. They will then engage in the scenario. You will have a 5-minute warning before the scenario ends. On the day, can I ask the tutors to arrive at around 8:30 so you can familiarize yourself with the clinical station and meet the SP, and this will allow us to make sure that you're happy with how the station is going to run. Myself and the staff from the education center will be on hand all day to provide support and help. Parking information has already been sent to all of you, and parking is being provided for non-LTHTR tutors, and I gather Gemma Shaw has already organized this. There will be trainee feedback and certification provided for you for support of the day. Therefore, can I just once again thank all of you for your participation on the 15th. I'd especially like to thank those individuals who contributed to writing of the clinical scenarios and quality assuring the scenarios. The venue will be Royal Preston Education Centre 2, which is the undergraduate centre. If there are any issues, please contact me via email or by phone beforehand on the day. If there are any problems, please contact the Education Centre at Royal Preston, and that's Education Centre 2. I look forward to seeing you on the 15th. Many thanks yet again.